Usually Friday you get to go home, but the rest of the day. Or do you guys usually have clinic Friday afternoons?
No.
Sometimes.
Oh.
Sometimes you do?
Yeah, sometimes. I had clinic today.
But
in the afternoon?
In the
No,
morning.
afternoon, no afternoon, nothing.
You never have?
Patient afternoon, no.
On Friday? No. It's after
3 o'clock?
3 o'clock.
Not till 5.
Not till 5. Yeah.
Oh, till 5.
Do they even start accepting patients after noon? I don't think so.
I don't even know.
I know radiology doesn't work.
Yeah.
The last patient you can take X-ray is 10:30.
Okay, but really?
Yes, radiology will close.
You have to take X-rays on all your hygiene patients? But aren't some of these hygiene patients? If you take the X-rays, who does the dental work if they need fillings?
They do filling.
Okay, so you are seeing new patients for hygiene? You are doing hygiene before they have the fillings done and things like that? Then they assign these patients?
Dr. Jules make a decision that X-ray need a filling, endo, extraction, and then if they need,
they refer them
they
to the
send
dental?
them there. Yeah.
Okay.
No, with us. We clean them.
But do you get patients that are already dental students are seeing and you guys do the hygiene?
We can do that if they're nice to pass it, but in the morning they didn't do it. I found a patient for Noah, and one of my dental students found him, and his faculty said no, we can pass it to dental student, not hygiene. And they didn't pass it.
Oh.
Are you serious?
Yes. I
That's
told
so
him Sellington because he was my friend.
Yeah.
I told all my friends upstairs, dental student, I know 20 of them, we need a SRP. If you have SRP, pass it to us. You guys don't need it that much. They just need 2. And then not worse like ours.
SRP is what?
Scaling and root practice.
Scaling is.
Yes, to go deep.
That's messed up. Because I feel like they get SRP patients all the time.
Yeah, they have a bunch of them. They have a worse one. Because most of the people go to the urgent care, and then urgent care send them to the dental student, not us. Yeah, that's the point. Because they said someone is in urgent care, they don't need hygiene. They go to the dentist because they're an emergency. They say lots of stuff.
Okay, so I suggested we had get rid of that post quiz.
Oh goodness, that was the worst one.
Okay.
Post one, yeah. That was too much. No?
The post one?
A lot of information.
That was over soft tissue?
Soft tissue.
And then we can go over like the lecture today and take the quiz.
Yes,
after.
yeah.
Oh, yeah, that'd be nice.
I didn't study for that one.
All right.
I need help.
Yeah. All right. Let's do that then.
Quiz.
We got this. God, I'm scared.
Oh, and she makes you fill in the answers.
Yes.
Yeah, that one is the filling one. There you go.
Man.
Wait, what?
How many?
12.
No, I think there's 12.
It's either you know it or you don't.
Turn this on, though. All right, today is 15th, right?
Yep.
And who has a birthday this month? None of you?
No.
Oh, I
On
was gonna give
January.
you, I was gonna take the test for you if you did.
Oh
but-
my god,
Really, it's my
birthday. You're not gonna be here on May, but I mean we can celebrate early.
Well, which month is yours?
When is mine?
Yeah.
When is yours?
May
May what?
29.
First of the month.
First of
May.
which one?
May.
May 1st.
Oh.
Yours.
January.
Okay.
In October.
Those are all, we're all over the place.
Yes.
Yeah.
All right, here we go. I would want to ask, what would be a couple, or name one of a couple possibilities? That would
Yeah.
be my different way of asking this.
Mm-hmm.
Because there is one more thing
Yeah, there's
too.
more than one thing.
Yeah.
She has a set, she does.
Oh,
She-
goodness,
She doesn't
okay.
do much time, huh?
Mm-hmm. 26 means it should be mandible. Why it's maxillary?
No,
Yeah.
26-year-old female,
Oh,
not two
got it, okay.
26.
My bad.
Oh.
26 female, she has
Oh, huh. All right, you ready?
Mm-hmm.
3. You ready? That was easy.
Yeah, that was good.
Now, there can be more than one answer for this one.
Are you
Just try
grading
to
these?
find.
Huh?
No,
Are you grading
she
these?
won't. No.
Well,
You will?
when I say, when I grade your paper, there is more than one answer.
Yeah, that's true.
But she said top of your. Means the first
Your
thing.
top may be different than my top.
Yes.
That's true.
This course is tricky. I
See?
swear, it's tricky.
It's either you get it
Yes.
or you
Are you calling me tricky?
No. I'm calling oral path.
Oh, tricky, okay.
Oops,
wait.
the other one was.
Okay, you ready? Okay, here we go, 5.
that was tricky.
Yeah, it is, a little bit. It is a little
Yeah,
tricky.
I don't.
Let's see how we do.
Can be wait letter please.
Pardon?
Wait letter please. Nothing.
She said just to wait a little bit.
Oh,
Yeah, she's still trying to figure it out.
what's confusing, you see a radiolucency here related to tooth, and on the other slides you had a radiolucency related to a tooth, right?
Yeah. So too little.
Oh, the pimple was a pus?
Pimple
Was
was,
a pus because
pus.
they popped it and then the pain
yes,
goes away.
right, so it was draining,
That was the infection.
right. So, but she's asking what is the diagnosis of the bony lesion?
But the root is absorbed too, yes?
The root is what?
Absorbed. Root part, there's no
Resorb.
root.
Resorbed?
Reserved.
Just a little bit maybe, I'm not sure,
No?
yeah.
I don't know.
I mean, it looks like it a little bit maybe. All right, ready?
What's the best explanation for the pimple?
Oh, okay.
Pimples that appear?
What is the best explanation of a pimple that appeared above the tooth?
Like why it happened?
Or what is the explanation?
I don't know.
Goodness.
Well, okay, I got it, yeah.
That's not fair. We study so hard and I don't know none of them.
The best
Oh.
explanation for it, I guess she's asking, what is the pimple?
What's inside the pimple? Is this like
Well,
something
to know
so
what's
simple?
its
That was an abscess.
I guess that could be part of the answer too, what you're saying.
Because like I can say like, what's a pimple? Pus.
Right.
Yeah, that's
Yeah, but I'm not,
I don't know.
I don't know what she's after. I mean,
Oh, others?
I see what your answer is, I put mine a little different,
Yeah,
but it relates to what you said.
yeah.
Would those white thing, the radio opacity be
What
like
they
filling?
did, no, that radiopaque area,
Yeah.
Yeah.
they stuck that in the pimple. They stuck that into the pimple.
And drained.
And rain, yeah.
Whether they didn't drain it, it was already draining.
Oh.
If you had a pimple, it's already draining.
Yeah.
So they stuck this in to see where now I'm telling you my answer. They stuck that gutta percha in the pimple, and it kept going. So it followed along something and ended up at this radiolucency. So there was a canal there. So they stuck it in the pimple, and that went down the canal, and it hit the radiolucency. So, I mean, one reason they do that, why did you tell me why they do that? Why are they doing that? They want to know if this pimple is related to this tooth. So if they stick a gutta percha in there, it's telling you that this canal
or pathway
is the pathway
to the pimple.
radiolucency. So again, there's like more than one answer in some ways. I'm not sure what she's asking for.
Like why it appeared?
It could be, you know.
You can actually kind of see the little path. I don't know if I'm looking at the right thing.
Okay, number 7. To make you feel better, I have no idea what this is. I don't.
But it has a vessel on it.
I have no idea.
It has vessel on it, and it's movable. And it didn't grow.
I could guess a couple things.
But it didn't grow.
We can give you a...
Well,
Is it
yes,
fat?
it's growing.
Well,
Says
fat doesn't grow.
It's slowly enlarging over 3 years. What is this? 7 years?
It could be a few possibilities.
It could be, yes. Yeah. I'm not sure what you're shooting for. What I put for an answer, I would like to see a better one to match my answer. I don't know. We'll see what you guys decide.
It's not lipoma.
A what?
Lipoma. It has vessel on
That's what I put.
it.
But it's not a good example.
No.
Prove it to me prove it back
No.
to me.
I just think between all the stuff that I studied today, nothing looked like this instead of lipoma. But in final, if someone asked me like this, I don't know.
But prove to me that's a fibroma looking at it.
What is fibroma?
Not a fibroma,
Oh.
lipoma.
Oh, lipoma.
Did you say fibroma or lipoma?
No, lipoma.
Yeah. Prove to me that's a lipoma.
Has a vessel on it and
It's
didn't
got a
grow.
what?
Vessel. Blood vessel.
Okay.
It's been there for
Right.
3 years.
That's, I mean, you got a point.
And there
That's
is nothing
probably as
else
good
look
as
like
anything.
this.
Right.
But
That
if I
has-
have a patient like this, I can say
Right.
what is it.
Right.
Yeah.
But I think you made a good point, that you do see the vessels on top of it.
Yeah.
I had a hard time with it. I had to think about that. I mean, there's other puzzles. Why couldn't you have a salivary gland tumor in the lip? But you haven't had salivary glands yet. See?
But that one grows. They get big, no?
Yeah, well, this one's growing too.
No, it said no. It's about 3 years in young.
It says that free movable mass has slowly but steadily enlarged.
Oh,
That
okay.
means it's still growing.
Still growing. Or like, what is that wrong? I don't know. Goodness.
Okay, you ready?
Yeah.
Yeah, you better not miss this one. I remember taking this picture.
Yes, yeah, we saw that.
It's the cute one.
It's a cute,
It's a cute
my
one.
favorite picture. I even forgot the name of it. Yeah. But see, when I've been haven't been around things for 5 years, I forget. Okay, that was easy, right?
Mm-hmm.
I love that picture. What is this growing out of my tooth? Okay, 9.
This thought you will have been over.
Did you need, was there enough time on that one?
I was good.
All
Are
right.
you guys good?
10. Okay, 11. Oh, that was it.
Done. Thank God.
Wait, that's it?
Uh-huh.
Are we gonna go over them? Okay.
All right, you ready?
Yes.
You gotta grade your own.
Yeah.
Okay, so let's go back to the beginning. Okay. What did you put for this?
Granular cell
cell tumor.
tumor.
Mm-hmm.
They mix it
Why
with
did you
the
put that?
squamous cell carcinoma.
Painless mass.
Painless mass.
And young
Okay.
child.
But here is one reason why I had problems with this. The average age for, you said granular cell tumor, right?
Yeah.
Mm-hmm.
I was.
The average age is not young.
Oh goodness.
Look at your,
So can it be a schwannoma?
yeah, it could, to me, the answer she wanted, because I looked back at old slides, and that she has that labeled granular cell.
Yeah.
Tumor,
Right.
yeah.
That's
But-
what we-
But when you go to granular cell tumor, where is it here? I'm looking in the notes. Here, granular cell tumor, age, 4th to 6th decade. You're talking 40, 50-year-olds,
Yeah.
Mhm.
not young.
Okay, then it is wrong.
No,
No.
I had a hard time with this because I looked back to her lecture, and this is the picture she used for a lecture for granular cell tumor.
Yes.
Yeah, that's why.
I saw the picture and said it's that one.
So I put granular cell tumor also, but I could put schwannoma.
That's what I
Schwannoma is
put.
in a younger person.
That's what I put first, but then I was like,
No,
I remember this picture.
I would have given you. You remembered the picture?
Yeah.
I would have given you credit for either one.
Either one. Yeah. I put that one first, but then
Okay.
yeah.
Okay, this one.
Apical.
So let's talk about it.
Mhm.
Once this incidental finding, so she never ever had pain.
Yeah. So it's.
So it was never acute.
Mhm.
right?
So it's chronic.
It was chronic. Right.
Chronic apical
Okay.
periodontitis.
That's what I put.
Mhm.
Chronic. Well, yeah, or that's one of the answers I would accept.
Yeah.
But I like the better answer. I put a little different one.
Yeah.
What did you guys put?
Apical period.
Periodontitis.
Okay.
Wait, which one?
Periodontal cyst.
What did you put?
Periodontal cyst, the apical one. I said it's
The
at the end
apical
of
cyst.
yeah, end
Okay.
of the root.
Right. And I also put same thing you did, or the old term. I put apical cyst.
Should I add chronic to it?
Now-
guys?
To me, there's two answers. You either got an apical cyst,
Mhm.
or you got chronic apical periodontitis,
Okay.
which is a dental granuloma.
Mhm.
You cannot tell the difference on an X-ray.
Okay.
You cannot tell the difference. Okay, why did I choose cyst? Why did I choose your answer instead
Cyst.
of your answer? There is a reason up there. Look at it real close.
Is it because of the picture, right?
Yes,
Is it the rim around
it-
the
yeah.
radial vicinity?
yes. It looks more like, it has the characteristics of a cyst. It has the definite border of a cyst.
Yeah, it's radiolucent.
Okay.
Yes.
What is a cyst?
It's radiolucent, right, but that's, so, it looks more like a cyst. I would have to give credit for both, but I like the cyst. You can't tell, there's no way you can tell the difference,
Yeah.
absolutely no way. Only way you can tell the difference is by an X-ray. Okay, this one,
Epilus
Fissure.
Fissurated.
this one,
pyogenic granuloma. Because
Mhm.
it's
One of the three.
bloody.
It bleeds. That's why I put that.
yeah, you know what, I think I know what it is.
What is
I
it?
don't think it's pyogenic granuloma,
It is not?
no, but
Why?
because I took the picture. I
What
know
was
what it
it?
is. I'll give you credit, and I agree what she says. I have to look back at the original. Could be one of three things. What are the three P's?
Oh, it
Pyogenic
would be
Pyogenic,
the third
peripheral
one.
giant cell,
Ossifying.
Or
Ossifying. It's
or
ossifying.
peripheral ossifying fibroma.
Mhm.
I put peripheral giant cell,
Yeah.
and I think,
Giant cell is purple. It's not
no,
bloody.
no,
No? Goodness.
no, and, I don't know if this one's, I'll have to look at my original pictures to see what it was. But, yeah, the best answer is pyogenic granuloma.
I have a question. So I put peripheral ossifying fibroma, but how do you know it's not hemangioma?
Hemangiomas wouldn't look like that. Hemangiomas wouldn't be
It's
Like it's
ossifying?
wouldn't be a separate thing. Hemangiomas would be elevated and it would be blue.
Okay.
But I'll show you a peripheral ossifying. You put what?
I put peripheral ossifying fibroma.
I'll show you a peripheral ossifying fibroma that shows you it looks just like that.
It does.
So what
Yes.
is the answer of that? Ossifying?
To me, it needs to go to three.
3 P's?
Yes.
Will you give us credit?
Yeah.
Yeah.
Because
And she won't change him? Promise she won't change him? Okay.
I took the picture. I know what it is. Yeah.
But the picture that you taught us about the ossifying, that was not bloody or purple.
Usually
nothing.
they're not, but they
It
can
was
be.
pink. Oh.
Okay, let's hold on. Look at something. How'd we find my slides the other day?
We should go all the way down to the left and then search. Here you go, yes.
So we want soft tissue.
Soft tissue
Slides.
lesion and stuff.
Soft tissue lesions, here we go. Oh, I want, actually no, I want to copy my slides. There used to be shortcut to slides. What happened to it? Oh, here it is. Short, there it is, got it over here. Okay, so we want soft tissue, here we go. And we want to look up what? We want to look up
Soft tissue.
peripheral fibroma.
Oh yeah, exactly. Number 2. Holy moly.
Who got it right?
Yes.
He got it right.
Layla.
Well, that's not the answer she was looking for. She was
Huh.
looking for pyrogenic granuloma.
Was she
How
Wow.
did you know she knows it's the answer?
Because she said bleeding.
Yeah.
Oh,
And that one
ossifying
doesn't
doesn't bleed.
I say you can't tell the difference.
Got it.
You have an idea. Okay?
Yeah.
Now, would I say peripheral fibroma on this if I didn't know any history? No, I wouldn't say peripheral fibroma. Because most peripheral fibromas,
But we will get credit no matter what.
yeah, I
Are
mean,
you sure, Heidi John?
Yeah, are you sure?
you see why? You see what I'm saying?
Everybody get credit.
Yeah. Any of those three, you can't tell the, and he got it right by mistake.
Yeah.
You got it right because you knew it was that picture.
I just said it's bleeding, so it's
All right, here's another one.
hygienic.
This is
Oh,
peripheral
yeah.
fibroma. Now, this is what
Yeah,
a peripheral
that one is
that's a
fibrosis.
peripheral
Pink.
fibroma. You wouldn't have a hard time that, would you?
No.
Yeah, it just tricked me because it said bleeding, and I remember you specifically was like.
The pyogenic granuloma is the one
Frisky
that bleeds.
bleeding, yeah.
Right. So, to me, all the answers are right. Now, I would, if you put pyogenic granuloma on this one, I would have a hard time. Now, if you have a pyogenic granuloma and you don't remove it, it goes into a peripheral fibroma.
Oh, right.
Mm.
Okay. Okay, good. Hey, you guys doing good. All right. Yeah, you are.
I won't. I fail again.
You worry what?
Fail again. That's too much. All of them together.
Okay, we went post quiz.
The first
No,
one.
that was a good question, but yeah, we got it right. Okay, this one.
Is it a dental abscess?
Dental abscess because you get infection.
So what is the best diagnosis for this bony lesion associated with the tooth?
What did you say?
I put chronic apical periodontitis.
Oh.
I scratched that out. I thought it was a dental
What do you put?
abscess. I just put a dental abscess.
Okay, you're wrong. You have to mark that wrong because you cannot diagnose an abscess from an X-ray. Abscess means swelling. Remember we talked about that.
That's what.
We fortunately we look at say an abscess, but what is the best diagnosis for this bony lesion associated with the tooth? Well, she didn't talk about. See, I don't know what she wants. She's looking at radiolucency. This looks more like a chronic apical periodontitis, and it's chronic now because it's draining. It was acute, now it's chronic. What did you put?
I said it's dental abscess because you said
Yeah, see, that'd be
pause
wrong,
on
too.
it and then it
Yeah,
pause. No, it's
Right.
like
we would call it.
Cyst of the adult?
What'd you call what?
Cyst of the adult?
system adult.
Yeah, I don't know why.
I didn't hear you.
Cyst of the adult.
System the adult.
Cyst of the adult?
Yeah, that's something she had there.
No.
That's what
Oh.
I
So yours
thought
would
of.
be one. You guys got a bunch.
All of them, yeah. It's wrong.
So, and I'm not sure what she wants on that, but to me, it's a draining tract for, well, it's radiolucency,
one.
so it has
Huh?
to be a chronic apical periodontitis.
So a dental
Dental
abscess
cyst.
can't be seen on a radiograph.
You cannot see a dental abscess
Or
on a
that one that
radiograph.
you
Only
wrote.
clinically.
That
Only
one is
clinically.
correct too.
Oh.
Dental
okay.
abscess is when you have swelling,
I think so.
Okay.
all right? Okay, next. How about this one?
Lipoma.
You all put lipoma?
Oh,
Wait, what
we
was the
skipped-
other question?
Number 6.
Oh. Okay, number
Yeah, it
6.
has 2 questions.
Okay.
Why did
What is the best explanation for the pimple that appears above this tooth?
It's
I
like
don't know what you want. I put fistulous tract.
I put that too based on what you what you said.
Yeah. What is the best explanation for the pimple? Best explanation, we have a fistulous
Fistulous.
tract
Mhm.
from a chronic behavioral periodontitis.
Can we write to drain the pus from the canal? No? That's wrong?
That's, no, in some ways, that's right.
Mhm. Yeah.
That's just, you're explaining it a little more.
Yep.
Yeah, that's why the pimple's there. It's draining the pus. What'd you put?
Yep. Draining.
Great.
Draining.
It's
of
a
it.
draining-
Yeah.
Draining fistula.
Yeah.
Right, so we all kind of put the same thing. Okay, this one?
Lipoma?
Like
They didn't have anything
I had a
like
hard
this.
time with this, but I have to agree with you, probably
Breast
lipoma.
cells.
This one?
Chronic
Chronic
Plastic
hyperplastic
pulpitis. This one?
pulpitis?
Pulpitis.
Pulpitis.
Oh wait, which one?
9.
Yeah.
What if you put acute?
Apical.
Apical
periodontitis.
That's what I
periodontitis.
put.
Okay.
Oh,
that's what I
okay.
put too.
The other one?
Because why? She said, it's acute because pain relieves the pressure. I mean, ice relieves the pressure. Ice relieves the pressure.
Ice. Okay.
And this one?
Irritation,
fibroma. That's an easy one.
All right, so you missed
5 I didn't. No, 5.
5.
No, she
You
missed number
Oh.
5.
Number
Number
5.
5, right.
Yeah.
I also missed number 5.
I missed number 5 too. Because I put cyst of the adult.
Oh, yeah, okay. So you guys all got 9 over
10.
9 over 10. All right, so put 9 over 10 on the top. Wait, you gotta do it in my red pen.
How about the pyogenic granuloma? She won't change it?
No, oh, no.
I have it. Do you want it?
Oh yeah.
No, for that one, yeah. Yeah, I think that's what you wanted.
Which one?
The number 4.
Let me
I think that's
mark
what
this.
she was asking for. Okay, you guys did
Should
pretty
I
good on
mark
that.
it or no? Should I mark it?
For what?
For pyogenic
No, that's
granuloma?
okay.
Can you go over the bone and then do the pre-quiz? I didn't study
Well,
for
no,
that.
that's not called a pre-quiz, then you
Thank
gotta
you
call
so
it a post quiz.
I'm gonna get 0.
We're
I
just
need to study
modifying
for
it a
that.
bit.
Okay, let's go over. it.
Thank
Alright.
you.
Cool.
Yeah, that's, okay. That is a little harder one. But you know what help us? First, just go through this first, okay?
Oh, okay.
Oh, her thing? Yeah.
Yeah, you got it, you got that?
Okay. So we are getting out at 3 o'clock today, or at
It'll probably be
Four.
about 3, no, we may get out.
No, I was looking for you. Did he reach you?
no?
No,
Oh.
ask
Oh,
where I can find you. Where he could find you.
I'll just text him or Facebook.
Okay, what can you tell me about hyperthyroid bone?
So the linea dura
Bone
is like
diseases
not
of the jaw.
visible. Of
Read
the
that.
tooth.
The what now?
I think
Dental lamina,
it's dental lamina. Yeah.
yes.
So
Well, where do you see that?
I'm trying to find it right now,
A
but that's
bone
something.
here, bro.
That's where I found it somewhere.
I just saw, like the
Dental. Yeah, it was a dental lamina, right?
something like that. Yeah.
Loss of the lamina dura. Yeah.
Yes.
Okay.
Mhm.
And you found that where?
In my
There it
notes.
is, in
Yeah,
your
right
notes.
there. Mhm.
There is loss of lamina dura around the teeth,
Mhm.
okay? Right? And one of the other classic things, you have this ground glass bone pattern.
Ground glass bone
Okay.
pattern.
Yeah.
Okay, guys.
bone. And let's see if we have a, okay, bony lesions, bone. Okay. This would be an the under. Tobacco. No, it'd be under metabolic. Don't have it. Okay, but let's look. Like Susan's got in her book here, she's got she wants me to be careful with the book because she has the author of the book signed her book for her.
Really?
Yeah.
Wow. Cool. Let me see.
So I swiped on which it wasn't working. But I did
Go
tell her
sell it on
afterwards I took it.
Amazon.
These books are expensive, they're about $100.
Yeah, we have to buy them every quarter sometimes.
Ah. She loves oral pie.
It's true passion.
Who can like that so?
Oh man, I don't know. I mean, it's interesting, but then when the exams come, it's like everything looks confusing.
Yes, all together, you know.
Yeah.
781.
This is like a good reason, guys. For boards.
Board doesn't have so much time. No,
Nothing
because
complicated.
it's not our job to fix that stuff.
Cherubism.
That's the easy one.
Yeah.
They get mad if we said this tooth
So
has
here-
cavity. So
Here is hyperparathyroidism with loss of the lama dura. See that?
Yeah.
There is no lama dura on that.
Yeah.
Yeah.
All right.
And other things, you can also have a tumor called Brown's tumor, right? So what is hyperparathyroidism? You're producing what?
Excessive
Too much
parathyroid
parathyroid hormone,
Too
right?
much parathyroid.
So, and they have a triad called stones, bones, and abdominal pain. That's kind of goes along with it, all right?
Okay.
And as far as and it has multiple radiolucencies also. I don't have a good picture of that. I don't know if she has a good picture of
Radiolucency?
yeah, it's it kind of has a ground glass appearance. Okay.
What does that mean, actually?
Ground glass, it's like a multilocular, yes, right.
Oh. So it's kind of like a pattern.
Yeah, it's kind of like a
diffuse-
multilocular, only tight.
Oh, okay.
It would be,
around
yeah.
the tooth, all the way.
Or like everywhere.
So that is some of the main characteristics of it. And it can involve all four quadrants, and you lose the lama dura around the teeth. Refer to the physician for treatment. So that's one of the main things. All right. So that's it. Okay, that's all. Now cherubism. Tell me what cherubism is.
In children by the age of 5,
Yes.
they look like they have chubby cheeks.
Why?
Because of the how do you say? It's like buildup of something. Not buildup, but
You get it's a bony lesion within the bone. You get
Yeah.
expansion of the bone, and it's bilateral.
okay,
Can be in the mandible and or the maxilla.
okay.
And why do they call them cherubism?
Because it's chubby. Just kidding.
Because
Like a bubble?
cherub.
Oh.
Cherub is what?
Oh,
Like an angel?
Fruit. Oh,
Angel. Oh.
Okay.
It's like a
So
bad
if you
angel?
got a good little kid, you call him, oh, he's a cherub, right?
Yeah.
Okay.
I've never heard of.
You know?
Yeah.
So cherubism means like you're looking heavenward.
Oh, cherub.
That cherubism. Because why do they look like they're looking heavenward? Because you have the swelling here, so it looks like they're looking up.
oh.
That's what cherubism
Oh,
is.
okay.
Does that make sense?
Yeah.
Okay, let's find
I won't forget that.
bone. So you get these multilocular lesions in all quadrants. All right? And these are like giant cell granulomas. Let's see if we can, let's look at some others here. Here's a couple more. See, and these are young kids. See the,
But we had this picture for the other one too.
had what?
We had this image for another.
Oh, you
case.
did?
Yes.
This is Grenner's, this is cherubism.
With cherubism, can you fix
I'm
it?
gonna blast him.
You know, after a while, see, here's a cherub, picture of a cherub looking heavenward,
Uh-huh.
and it's got puffy cheeks.
And that's like an angel, you
That's
said?
supposed to be like an angel.
Okay.
So this kid's kind of got a little bit cherubism, not real pronounced. Here's cherubism again, bilateral. You get these bilateral multilocular lesions. All right. So let's read this. Inherited bone disorder transmitted as autosomal dominant disorder. It's rare. Before age 5. Okay. Classic presentation: bilateral symmetric bony swellings of the mandible or maxilla. Macular involvement produces an upturned eyes, hence the name. See that in your note?
Mm-hmm.
All right. So it may be with missing, displaced, or delayed eruption of teeth. Well, the one I showed you before, that sure had problems with eruption.
So,
It did when it, look, all over the place. Teeth are all over the place.
oh,
And this kind of goes away after a while. They don't really have to go in and do anything. Later on in life, it kind of disappears. So may not require any treatment. If facial deformity is significant, may require cosmetic returning of the bone after skeletal growth is complete. So you don't do anything until later. Now, what it is, it's connective stroma, that's what's in the bone, contains a small trabecula of residual bone with multinucleated giant cells. It's a giant cell lesion in the bone, histologically, right? Let's see if we can see that.
is the expanded bone, is that less dense or is it more dense?
No, it's less dense because it's got all this radiolucency inside.
Yeah.
And look at this, when you see this, yeah. Look at all of it, because this is typical, and in all, could be in 2 or 4 quadrants. And here is giant cells, so it's made up of this granular tissue with giant cells. But she's not giving you the histology. You don't have to worry
But you
about it.
guys give the histology to the dental students.
Some. I don't make them come up with a diagnosis, but, you know. So that is cherubism, okay?
Okay.
Yeah. So you got bilateral, they're multilocular in could be 2 quadrants or all 4 quadrants of a young person, and no treatment. You don't
So
go
they
in.
have
You hope it goes away in some cases, right? Do we have that? Are you sure?
I hope so. I'll remember now.
Yeah.
Cherub.
Cherub. Yeah, cherub means looking up. Okay, back to bone. Now, we are going to talk about tori or exostosis.
Mm-hmm.
I'll tell you a story here that will help you remember. My son called me about 6 months ago. Oh man, what are these things growing above my teeth? I got these big bumps up here.
He got tori.
You got tori, maxillary tori on the buccal. So it's buccal exostosis.
So
Mm-hmm.
So I got out the path book, took a picture where it talks about buccal exostosis, and sent him all the information. So you can have buccal exostosis. Now, normally you can have mandibular tori, maxillary tori, which is in the middle, okay? or you can have the buccal exostosis, and you can have that both in the maxilla or the mandible. All right?
Mm-hmm.
Now, what is more common, palatal or mandibular?
Mandibular.
I would think it is, but when you read the book, they say maxillary, and I have a hard time buying that.
Most of my patients, they have mandible.
Right, yeah.
But Kayla
Let's-
has mine.
Let's look it up here. Tori.
When they say maxillary, it's like outside,
No,
right?
no, no.
Oh, the...
It's
Palate?
stomach, yes.
No, I
Like
thought,
a lamp out of the
I thought it
lettuce.
was mandible.
The
Yeah.
mandible is it's under the tongue
Yeah.
or here. I think so.
I remember this, what's the name? Richard said something.
Really?
Yeah.
I saw a patient. One of them that was under the tongue,
Yeah.
and then the other one top.
Palate.
Palate, yeah.
Torus palatinus.
Actually, do you know who Dr. Tan is?
No.
He's one of the restorative guys. His office right around the corner. He had mandibular tori that touched each other
And the lingual, right?
nearly on the lingual.
Oh.
He had to
Take
have
X-ray and put
he
the
had to have them
neurons.
removed.
Oh, removed.
Yeah. Mandibular tori, let's see if it says what percent. Bilateral movement goes to 90%. Doesn't say which one's more common. Exostosis. Anyway, okay, let's take some pictures of them. Let's look at pictures. Tori. Let's look at some mandibular tori.
There you go. It's under the tongue.
Yep.
One of my screening patients has
Yes.
See those?
Me
Yeah.
too.
it. Yeah.
And lots of them. They
My
have
SRP
mandible.
patient
Look at
has
those.
that.
Yeah.
How'd you like to have
Bad
those?
taking x-rays.
Blood vessels.
Look at this one nearly. Look at that one. How'd you like to have it in your mouth?
Wow.
How they can put the mirror and then see.
Yeah, I know how you eat your meal, right?
Or X-ray.
Can you imagine trying to cut a crown on these with those things? Here's a single one.
Why does it say lipoma for that?
I
Yeah, you could.
Yeah.
Too hard. How do you go back on this without going back on?
The arrow.
There
There's
is
a back.
no arrow.
On your keyboard?
Backspace? No, that doesn't help.
Like going back to the picture?
There you go.
Yeah, but then I want to go back to not all the pictures. I want to go back to. Oh, here we go.
Oh, yeah.
So I want to go to maxillary tori. No, why did it do that?
So you...
Oh, you could click bone.
Oh, bone. There we go. So I want maxillary tori.
Right there. Upward. Oh, yeah.
And look how big some of these babies get.
Wow.
And often they get ulcerated, like you see that
Yeah.
ulcerated.
Oh.
And then they really get sore because the mucosa is so thin.
Uh-huh.
So a lot of times these patients have to have these things removed, or if you're going to make a denture, like that. Look at this one. Would you like to have that up there? Now, if you could eat all day long, because once you ate, all the food gets up there and stays in there,
Mm-hmm.
right? And you would be eating all day long because food would keep coming off.
That's
Huh?
gross.
It's a storage.
I'll leave this one for later.
Like camel.
Now let's look at exostosis. Here is exostosis.
Oh, I
yes.
think she used the picture like that.
Yeah.
Oh, he has calculated.
Here's some more. See that? Bony growth. And look back here.
Oh, that's big, so.
Look at this one.
Oh.
All right. Here's another one. Here, look at this one. This on the mandible. You could lay a cup of coffee on that one.
Right there.
What happened to his gum on the tooth?
Here's
No,
where
not
they're
his
removing
dentist,
this. They
no.
went in and removed it.
Wow.
Yeah. Look at that one there. So, I mean, they really interfere with the denture or partial or doing dental work.
And this
Anything
is all
like
at
that.
the school,
Yeah,
right?
yeah, I took pictures at school.
Did you ever work at private practice?
Yeah,
Yeah?
I did private practice 1 day a week
Oh, okay.
Oh.
at a faculty practice.
Okay.
I started, I did two with other guys started at faculty.
Oh,
And
really?
Dan was in the practice. He still practices in the
Oh.
practice. Okay, so do we need to learn any more about that?
No,
No,
you're
we're
okay.
good.
Osteomyelitis. Osteomyelitis is what? Just inflammation of the bone, right?
Mm-hmm.
I don't know if osteomyelitis. Yeah, right here. What's it look like? A lot of times, osteomyelitis, you have swelling. Here's a guy came in all swollen. You got a toothache. Often you have a toothache, and tissue's all swollen around it. And you take an X-ray. Well, here's a swelling after a tooth is extracted. Sometimes you'll see that. All right. Here's another osteomyelitis. Sometimes what happens after a while, the bone, the epithelium won't heal over the bone, so the bone ends up to be dead, and so you get a sequestrum, and the dead bone comes right out, and then it heals. So you got a piece of dead bone in there, bone sequestrum they call it, and it can't heal until you get rid of that bone. Or sometimes you have to go in and take that bone out. And here shows you bone. This is bone with all the chronic inflammatory or acute inflammatory cells. Here's another one, kind of indirect. It's kind of they call it a moth-eaten look on bone.
Yeah.
Moth-eaten. Oh, here's this good example right here. Okay, see that?
The dead part.
It's kind of moth-eaten. So he had, so it goes on for several weeks. All right.
Yeah.
So that's acute osteomyelitis. So let's read what it says here. Osteomyelitis is an infection spreading through trabecular bone and usually producing necrosis of the bone. So once the bone dies, you can't get healing over the top of it. So you get a sequestrum bone that comes out. All right.
What is sequestrum?
Sequestrum just means that the bone gets rid of itself.
Okay.
Yeah. If something sequesters, it's like pus and body wants to get rid of it.
Okay.
Radiographic requires at least 2 weeks to produce detectable radiographic changes. So here you definitely have radiographic changes, all right?
Would that be chronic or acute?
That could be chronic or acute. Depends how.
on-
Depends how. If it went long enough, it'd be chronic. But when it's really all swollen up and sore and pain, that's acute.
Acute.
Okay.
Yeah.
And this is an infection spreading.
It's an
through?
infection that spreads through it. So osteomyelitis is an infection that spreads through the bone,
Okay.
all right?
Okay.
So you treat them with antibiotics, and it says here sometimes what's necessary, it's in your thing, is to actually go in and curette that area out. All right? It says under radiographic features, once present, destruction of bone appears radiographic as areas of lucency with diffuse and ill-defined margins. Well, that's what you got here. See? All right, the next one. Tell me what condensing osteitis is. Well,
Oh, we talked about it yesterday, I think. Oh no, not yesterday. Last couple weeks. It's basically forming bone at the apex of the tooth.
yes, why?
Because that tooth has a big cavity
The
before.
tooth has a big cavity, but not enough to kill the tooth to cause an abscess. It's kind of a mild, you got inflammation of the pulp, but it's usually on young people because you have a good blood supply to the pulp. And so what happens, that irritation stimulates bone instead of bone going away.
Mm-hmm.
So let's look at, I want to look at pulpit period. And you see pulpit period. Bone. This is size. I'm going to show you some good examples of it. Bone sequestrum. Oh, here we go. Here we go. Got good pictures of it. Here is the best picture that you'll find.
Yeah.
And you can see the apex of the bone, and you can see the lamina dura around it, which we look at cemento osteoblastoma yesterday, but you can't see it into the tooth. So after a while, now if you extracted the tooth, so it's just dense bone, and it doesn't have a very good outline. See that? Indistinct outline? It's not good. It's not like a nice line. So if you extracted the tooth, that dense bone could stay there, and actually, it's called a bone scar then.
So it's not radiolucent.
No, it's radiopaque. It's dense bone. It's not right. And it says localized areas have dense opacity that is confluent with the lamina dura. Yep. The periodontal ligament space of the tooth remains visible, which we see here. All right. Entire root outline is visible, which we see. Associated tooth typically shows a larger restoration or deeper caries. So it's in a tooth that has deep caries or a large restoration. Right? Do we have that? No treatment. No treatment is necessary. Eventually, though, you're probably going to have to do a root canal, because eventually the tooth is probably going to die. All right.
Which is irreversible pulpitis?
It's going to lead to an irreversible pulpitis, yet. Okay, here's the next one. Idiopathic osteosclerosis. Now, this one here, what happens, we don't know what causes it. It says cause for this condition of focal dense sclerotic bone is difficult, unknown, we don't know. Okay? At age, young adults, asymptomatic, so radiographic features, fairly well defined, pure opaque lesion that is confluent with lamina dura of the tooth, around the periodontal ligament. All right, so this is what this one looks like. Looks like this. You got a tooth that has no cavity or no filling. So I would call this then idiopathic osteosclerosis.
So that is also dense bone?
That's dense bone.
Okay.
And I'm going to show you some more. Here's another one. Sometimes it's like this. This could be a bone scar on that one, where maybe you had a tooth there that had condensing osteitis. Here's another one. See this?
What is that? Amalgam?
Yes, that's amalgam. Yeah. But see here? This is idiopathic osteosclerosis. Here's another great idiopathic osteosclerosis. There's no radiolucent, see, around the bone?
Yeah.
Yeah.
Compared to.
Some of the others we're going to talk about.
So any
So you don't do no treatment whatsoever.
Any radiopaque around
Radiopaque.
radiopaque around the root is condensing osteitis. So
It's usually somewhere, condensing osteitis is right at the apex. It's connected to the tooth. This one doesn't have to be connected to the tooth.
Okay.
radiopaque.
It can be between teeth. Okay, tell me what cemento osseous dysplasia is.
I know there's two types. There's florid and
There's periapical cemento dysplasia and florid.
florid is
Right.
all the mouth.
Okay, and what is one characteristic that you usually see this in?
At the apex of the tooth.
At the apex?
And it's first it's radiolucent.
Right.
And it becomes.
Why is it
radiopaque.
radiolucent? Bone is replaced by fibrous tissue. Then after a while, the fibrous tissue starts to get calcified, so it becomes a mixed lesion, and as it matures, you get more calcification. In the end, it's a radiopaque lesion. So it goes, and often has multiple teeth. Okay? And more often in women than men. And what about nationality?
I think it's like.
Are they Iranian or
African
Mexicans?
African American?
It's African American.
Yeah.
Nearly always African American. We don't know why.
Wait, why? Yeah.
Yeah, we don't know why.
If you had to make your best guess, like why you would think.
I don't know. The genetic factor of some type.
Yeah.
Yeah. But you can see them in Caucasian, but 90% will be a black female. When you show me the x-ray, I would say, okay, what is it? Black female. All right. Okay, let's look at Okay. Right here, really good ones here we got. Oh wait, that's the well, she didn't talk about focal to you. She talked about,
So what's the difference between periapical and the florid?
she talked about periapical and florid. Okay, so I gotta go back to the periapical. There it is. This is classic right here. This is a mature stage.
And that's periapical, right?
That's, yeah,
Yeah.
yeah. And in the early stage, now this is classic. If you showed me that picture, I'm gonna tell you, this is periapical cemental dysplasia. It's got that radiolucency around it, which condensing osteitis wouldn't have that big radiolucency, wouldn't have the radiolucency. Now here's an early stage of it, could be. So you have 3 stages. This is classic. See this? Often in the apex. This is really classic. Look at all these teeth involved.
So it has a bunch.
I had a young gal come in, and oh, this is classic. I had a young gal come up in my office, so the endodontist went in and did root canals on all 4 anteriors because he saw these radiolucencies.
Oh.
And when he opened each tooth, he said, "This tooth is vital. This tooth is vital," and it kept opening. So we charged her for 4 root canals. She never needed any because of periapical cemental dysplasia.
Wow.
Poor.
Now, focal cemental dysplasia is when you, again, black females, but it's totally different. Then, well, that's florid, not focal, florid. And it is several quadrants, okay? And actually what can happen, they can have a lot of osteomyelitis afterwards. You never want to extract the tooth because sometimes the bone won't heal. And let's take a look at one of those.
She wrote not covered in this course
What?
for focal cemento osseous.
Yeah, not covered, right. It's fairly rare. It's not really common. So we want florid. Here it is. This is classic of florid. Look, can be all quadrants. See that? And then you even got some up here. All right. That is classic for florid. Black females, and they could be infection. And somewhere she's got to say it. It says near the bottom page, do not extract teeth unless necessary. Affected bone will not support dentures well. Okay. Lesions and surrounding bone do not fight infections well. Therefore, it's imperative to treat all the sources of infection. All right. So you don't want to have to extract teeth because sometimes it will never heal. Does that make sense?
Mm-hmm.
All right, here's some more on the dentures ridge. Look at this. So these are in the 3rd stage. Remember, early stage is radiolucent, mixed, and radiopaque. Black females. Remember that. All right. And what's next? What can you say about fibrous dysplasia?
Ground glass looking.
Yes, right. Okay, fibrous dysplasia usually starts in young adults. We don't know why. Okay, my wife had a cousin who had this really bad. And it can be often as posterior maxilla, the mandible will expand. Early stages it's radiolucent, and then after a while it gets more radiopaque. But you get expansion of the jaw. It can be in the mandible. Now, you can have monostotic type that's only in one bone, or polyostotic is in multiple bones. You can get it all throughout the body. Okay? So let's look at some cases of it, and then you'll understand it. And there also, classic presentation is, let's go back, here we go. She didn't give much information. Okay, ground glass is the classic, it's classic for it. And you never radiate it either. It's a benign fibroosseous lesion of developmental origin, and you get a lot of expansion. So you have polyostotic and you have monostotic. Poly has many bones, monostotic is one bone. So the monostotic is asymptomatic jaw enlargement, producing facial asymmetry. So usually it's one side, and it's one side that's involved. So let's show you some slides, and you can see it. Right here. I get some good slides about it. So this is really far-fetched, but that's what can happen. And it can be in the hands.
Wow.
So this is a polyostotic. And so this is the early stage. It's going to be this stage. This is the later stage. So this is fibrous tissue, and that's why it's radiolucent, and then it gets calcified. And here's a girl. You can see her, see how much, see this side, see the difference? So it's the expansion of the jaw on this side. I'll get the better picture. Oh, this is how big the jaw is. This is the later stage. This is classic picture right here. Ground glass appearance. Ground glass. This is when it's mature. And let me show you. Okay, here's the picture I like the best. Look at this girl. Okay, so she has expansion here. Now let's look in her mouth. Wow, this is the other side. But look how this is wider than this side. Okay, this picture got turned around. Here it is again. And this is fibrous tissue. Now it starts to lay down this bone. This is bone here. See? So as time goes on, more bone. So it changes from radiolucent to radiopaque. And it can be mixed in the middle. So ground glass is classic, and you get expansion of the jaw. So the jaw keeps growing, and it's unilateral on one area. The most common area in the mouth is the maxilla. And it says here, under sites of predilection, will not cross the midline.
So it's only on the maxilla?
No, it can be in the mandible too.
Mandible.
But a lot of times it's on the maxilla.
Okay.
And no pain?
Posterior maxilla.
No pain?
No, slow growing. Takes I think maybe later on in sometimes it can. But, and then it stops, here's the other thing. So it happens when you're young, but then when you get older, it stops growing. And then you can go back and sometimes recontour it, surgically, but you never want to do it early because what happens, it will actually cause some problems. Now, here's something that's really important. You never radiate it. When I first moved down here in 1970, when I started taking my oral path residency, this story to help you remember. And you'll say, what's this story got to do with it? So, how when you move, you're late one night, and you finally get down at midnight, you're in a new place here in Loma Linda. So finally went to bed, 4 o'clock or 6 o'clock, man, bang, 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 bang on the door. And here was a young girl about 30. I need your help in her bathrobe. I said, yeah, what do you need? So I ran across the street. Well, under her sink, the faucet, one of the pipes came down. So she was getting water going everywhere. Well, all you had to do was go in and turn the valve off. I look really brave doing that. I look like the savior. So, why was this young girl? Where's her husband? Her husband was a physician here at the hospital. But when he was young, he had fibrous dysplasia. This was years ago. So how did they treat fibrous dysplasia back then? They didn't know what it was. They radiated with X-ray. So they radiated him with X-ray, and then 10, 20, 30 years later, it turns into an osteosarcoma. So he had died the year before of osteosarcoma. Does that help you remember it? So you don't radiate these.
So how do you take X-rays of this?
Well, you can take X-rays.
Oh,
You don't
okay.
treat it with radiation.
Oh, okay.
Right. When I was young, I loved to buy shoes because when you bought shoes, in the middle of the shoe store, they had this machine you stepped on, you stuck your feet in it.
Yeah.
You know what I'm talking about, and you look down, and then it was fluoroscopy, and so it was like radiation, and you could see the outline of the shoes, and you could see all your bony, and we thought that was great. Well, then they found out that caused cancer. Yeah, so they don't have them anymore, but I love to have shoes to go wiggle my toes. Now, when I was young, they radiated me for my adenoids. That's what they did back in those days. Well, a lot of times, I've always been afraid that I'd end up with osteosarcoma in my nasal cavity because of that, but I never did, unfortunately. They probably didn't radiate me enough. Otherwise, you guys wouldn't have to put up with it. So that is fibrous dysplasia. Okay? All right, you remember? You don't what? You don't radiate it.
No radiation.
And it's bilateral. Here's the young kid that has fibrous. Look at this. And what do you see? One side of the face. Right? And his is polyostotic. Okay, Paget's disease. What can you tell me about Paget's disease?
It looks like it's eating the tooth.
Do what?
It looks like it's eating the tooth when you see it.
Cotton ball
Yeah,
appearance.
cotton ball.
Right, and if you get old, well, you don't know what causes it. They think maybe it's, if you get old enough, it says most people will get Paget's disease. And a lot of times it can affect just the maxilla. Look at this gal. I'm going to show you the difference. Here, let's see if I can show you. Here she is. She used to come in every year. But look at her maxilla, how big it was. So it just affected that one area. And here's several years later. So look at how she changed over the years from there. So she had Paget's disease of the maxilla, right? And often you get this cotton wool appearance. This is her x-rays, all right? A couple of things you need to remember about this. Often middle age or older, you don't get it till you're 40 or more, right? And under radiographic, you have plastic presentation of multiple diffuse cotton wool opacities, okay? Here's the other thing. There is a lab for it, and it's increased serum alkaline phosphatase. You need to remember that. So these people that have Paget's disease have increased serum alkaline phosphatase. It's classic for the diagnosis. You don't do a whole lot for them. Not a whole lot you can do, but people that have, a lot of times bones will bow your legs. You can have it in your legs. They say if you get to be 90, you're going to have a little Paget's disease, but a certain amount can turn into osteosarcoma, Paget's disease. So let's look at Paget's disease. So you guys studied this, so you know a little bit what I'm talking about, right? Some of it rings a bell. Oh, what's the next one? Ossified fibroma. This is a hard one. Ossified fibroma, often it starts out as a radiolucency, like most of these do, but then, and it's well defined, very well defined, and as it goes along, it starts to be a mix, and it can end up a radio-opaque lesion. It expands the mandible. The early stage is purely radiolucent, as it says, And it's hard for you to understand these without understanding the microscopic. If you add the microscopic, you would know them a lot better. All right? Let's just take some pictures. Here's one. Well defined. Look how well defined. And this is a mixed lesion. I mean, you don't know what that is until you did the biopsy. Here's another one, early stage. That looks like a cyst, right? We don't know that it's ossifying fibroma. Here's another one, early stage, early stage, early stage. Here is a advanced stage, or a mixed lesion. So what you get? You got expansion of the mandible, all right? That's why this is hard. Here's an early stage. Here's a guy that has one, and here it is right here, this big one right here. Well defined a lot of times, all right? I think I have a whole series of them here. Oh, look, you see expansion of this? And here, this is the early stage. Now watch these stages. Here's somebody did a root canal. They didn't have to do a root canal. They never checked their vitality.
Yeah.
They just went in and did the root canal. So that, and here it is again. And here's another stage of it. But see how it's well defined? That's an that is ossifying fibroma. The next one is a tough one. Do you remember anything? Tell me about osteoblastoma.
Does that have to do with
It's a hard, it's a rare one. I don't even have any pictures of it. Let's read it. Osteoblastoma and osteoid osteoma. It's an osteoid osteomas are smaller than 2 centimeters. Osteoblastoma larger than 2 centimeters. Age, 30 years of age. Radiographic presentation, a well-circumscribed mixed radiopaque radiopathency, okay? Classic bullseye lesion, usually not seen. I don't know what they mean by that. Conservative treatment, so it's a well-defined mixed lesion. Well, so are the other ones we looked at,
Yeah.
Yeah.
all right? So the only way you know is histology. So, I mean, it's hard with you guys, don't have good pictures of these.
How long is this quiz today? For the pre-quiz?
Well, I don't know, there's 10 things here. Yeah. You might as well hand these out right
It's done?
now. No, we got a couple more things. We're just handing this out.
Okay.
Okay,
We went to the bathroom.
all right. So, that was a tough one. Now, central giant cell.
Awesome.
Central giant cell is like a peripheral giant cell. Now, one thing about a central giant cell, often in young people.
Central giant cell.
Yes. Yep. And let's look at, I got some good pictures of central
Oh, we're
giant.
looking at central giant cell now.
Yes. Yeah, osteoblastoma I don't have a whole. It's a well-defined mixed lesion. That's all
So,
I tell you.
okay, so osteoblastoma
I don't even know why they're even bringing this up. Why
and
would,
osteoid, because there's two of them.
I know.
Osteoid osteomas and then osteoblastoma. They're both like different sizes.
yes, right,
Okay.
right. The osteoblastoma is larger than 2 centimeters.
Is it always gonna be like at the apex of the tooth, like a
Usually around that,
preocular?
right,
Yeah.
yep. Around that area. Yep, I actually, you know what, it's so rare I've never really seen a patient with one. So I don't even know why you even getting a lecture on that one, but you should know it. I'll just give you a hint. Okay, central giant cell. Now here's a central giant cell. Classic. Young person, what does this look like if you were just looking at this? Give me some ideas.
What is the extraction of the tooth? The residual? No.
No, residual cyst, that's unilocular.
Yeah, unilocular.
So how would you describe this lesion?
Multiocular.
Multilocular. What are some multilocular lesions? What are sort of common multilocular lesions? Come on, we talked about it yesterday. A myeloblastoma. So these things are usually in young teenage.
Not dentigerous cyst.
No, because dentigerous cyst is usually unilocular. Yeah. So these are usually in teenage people. Age here says adolescents and young adults, usually less than 30 age. Symptoms, most often present, often asymptomatic swelling. Sites, any part of the jaw, can be mandible or maxilla. All right. And radiographic, well-defined radiolucency soap bubble. Here's another soap bubble. Looks like a myeloblastoma. And you only know from a radiograph. So let's look at some of these. Here's another one. Could this be the myeloblastoma?
Yeah.
Yes. Could it be a calcified epitheliodontogenic tumor? Yes. Same age group. So you only know, now here's a unilocular one. Look at this. That looks like some type of cyst. Could it be a unilocular myeloblastoma? Yes.
Yep.
Could be a dense too, condensing or.
No, condensing osteitis, that's bone.
Oh, okay.
Is this?
I won't be here for your next time you have the test on this. This is Dr. Richard's gonna give you the test.
Yes.
Oh, for this one?
Yeah.
Yes.
Next week she will be.
So, oh, you better know this stuff, man. Because otherwise I'll get fired. So here's another one, young person, what helps? Often young teenagers.
Do you know that? That's the reason you said you're
why
gonna-
aren't you
Huh?
Why aren't you coming?
It's Thanksgiving.
I'm not
I think.
coming down.
20,
She's gonna, because I'm missing a week. Is it right?
Yeah.
Isn't she on the schedule?
Yes. Yeah.
Yeah.
She's gonna lecture
Yeah. I have it.
salivary gland, and then she's gonna give you this test on bone.
There you go.
So you better know it.
So not this week?
This today. Next
Oh,
Friday,
oh,
it's
we-
Dr. Richard, and we don't have Thursday, I think.
So we meet up with Dr. Richards.
Yes, we have post-quiz, odontogenic tumors, and bone. And pre-quiz, salivary gland. Ta-da, we're gonna have fun.
So, look at this young girl. This young girl came in, and I saw her in the clinic, and I looked down here, look at this. This was the swelling. Slowly getting larger, slow growing. This had a blue color, which bothered me a little bit, looked like hemangioma.
Mhm.
Then I took an x-ray. This was the x-ray. So she had kind of a radiolucent, multilocular lesion in that area. Here it is again, and she had impacted tooth. These can be associated with an impacted tooth, all right? And this was a central giant cell. So often you'll see these in young people. Here's another one. They're radiolucent, often multilocular. A young person, you got to think of central giant cell.
Okay.
Young person. Could be teenage or younger. Multilocular. They can reoccur. Got that? If you guys don't get good, if you guys don't do good on a test next week with her, and you're doing good with all the tests on me,
Yes.
That's
we're
gonna look
we're gonna get 100.
You
I
better.
promise you. I'm
You're
gonna
go-
study so hard.
you better study on this.
Yeah, we are.
Alright. Okay, the osteosarcoma, what can you tell me about osteosarcomas?
It's a cancer of bone.
Malignant.
Cancer of bone, so you can have an osteosarcoma or you can have a chondrosarcoma.
Mhm.
Osteos, bone, chondros, chondroid.
Mhm.
One of the hygiene students several years ago actually had pain, and one of the symptoms is pain.
Yeah.
because it invades nerve. So this one girl had soreness in her knee, hygiene student, and they took, oh, you probably sprained your knee or something. It went on 6 months. Finally, when they took an x-ray, osteosarcoma, she lost her leg. Yeah,
Wow.
that was a long time ago. Yeah.
And she was still in the hygiene program?
I don't know what happened afterwards, but she was in the hygiene program when
Wow.
that started.
Wait, oh wow.
And people, you know, and it's, you know,
How does that happen?
you know, and osteosarcoma, a lot of times the bone looks moth-eaten. Let's look at osteosarcomas.
Could they have prevented that if they caught it ahead of
They,
time?
they might, nowadays they can treat it better, I think. Where's the osteo? Oh, here we go. Now, one characteristic of osteosarcoma, you get the sun ray effect. Do you remember that? That's on here. Under radiology, you get a sunburst. What do we mean by sunburst? And often you have pain in the tooth, but let me find a sunburst.
So it's not capsulated.
No, no, it's not. And often, this is sunburst right here.
Oh.
You get expansion. Sometimes it can be radiolucent or moth-eaten. Look at sunburst. See this sunburst?
Yeah.
Oh, yeah.
Very painful. Very painful.
Chondrosarcoma? Yeah.
And a lot of times,
Osteoblastoma. Oh wait, which one are you talking about?
Osteoblast.
osteosarcoma.
Sarcoma.
Oh, not the chondro.
So, and chondrosarcoma can be somewhat the same thing, all right? And here's something they called, I don't know if you put it, they call it Tutu syndrome. I don't know if they put that in here. What happens, somebody has a toothache, and they don't see anything wrong with it, they extract the tooth, and the patient says, oh, I know it's that tooth, so the dentist extracts that tooth, but yet they don't see anything yet, because it's early. It's an osteosarcoma along the periodontal ligament. And then the patient comes back a few weeks later and says, oh no, it's still hurting, you extract the wrong tooth.
Oh.
So now I know it was the other tooth. So the patient talks the dentist into extracting that tooth, they extract it, they still have pain. Finally the dentist says, something's wrong. They do a biopsy, and it's osteosarcoma. So they call that Tutu syndrome. Because you can have osteosarcoma in any bone. And often it's moth-eaten. Usually presents with pain and bony expansion under symptoms here. May have rapidly enlarged jaw. Other symptoms, loose teeth, toothache, paresthesia. Paresthesia is the main thing goes with osteosarcoma. A lot of pain. Bony expansion, ill-defined borders. Lesions may be mixed or opaque. Yeah, you wouldn't think they'd be opaque, but you saw here. And the sun ray effect, where is that? Do I even see it here? She never put that in there?
See.
Oh, that should have been in there.
Oh
Is
yeah.
it?
It says it,
Where is it?
under
Under what?
radiographic features.
Yeah?
It says on number 2, lesions may be mixed to opaque, although classic for skeletal lesions. The
Oh, sunburst. Yeah,
Sunburst.
right. Yeah. So here's an osteosarcoma, a massive thing in the jaw. I don't know if there's an x-ray of it. Ill-defined. You know, it's not like a well-defined
Sunburst.
cyst. Here's an osteosarcoma around the tooth. Not characteristic. I mean, you just can't look at the x-ray, but you go on with these cases with pain. Here's a big osteosarcoma right here. This looks like florid osseous dysplasia. There's an osteosarcoma of the anterior jaw. Look at that mass.
Wow.
Yeah.
How does it get to that level?
You know, they let it grow.
Oh my
That's a good.
gosh.
Here's an osteosarcoma that looks like a periapical lesion.
Yeah.
But here's a characteristic of osteosarcoma to remember. Widening of the periodontal membrane. Does she put that in here? Yes. Early lesion may show widening of the periodontal membrane. That's E number 3.
For osteosarcoma?
Yep. That is something to outline and remember. Widening, and here you see it. Look at this, right here. See that?
Oh, yeah.
Pain and widening. When you get pain and widening of the periodontal membrane, you got to think of osteosarcoma. Chondrosarcoma is really very similar in many ways. The 5-year survival rate is a little better, and it often is a little different age group. Average age for osteosarcoma, did she say? Young adults. Yeah. So chondrosarcoma would look similar, all right? Then let's look at the last thing, metastatic tumors. So what do we mean by metastatic tumors? So if you had a tumor of, let's say, the kidney, of the breast, of the lung, it can metastasize to the oral cavity. All right, so let me show you some. So anyone can metastasize. Epithelium here, I'll show you some. Metastatic, oh, here we go. Metastatic carcinoma. Okay, look at this. Here's a guy that came in and he had this mass in his palate. He couldn't get his denture in anymore. All right? It was ulcerated, fast growing, did a biopsy, and it was lung tissue. So it was metastatic lung. He was a smoker, he had cancer of the lung, and it metastasized to the oral cavity.
Wow.
Yep. Here's another picture of it. Here's another lesion on the lower mandible. This is upside down. Let's turn it around. There, that's better. And just bleeding mass, this was another lung one, all right? From the lung. Here's another one from the kidney. They extracted a tooth. This mass grew out of the kidney. Grew out of here. It was kidney. So he had a kidney cancer that he didn't know he had. So things can metastasize to the oral cavity. And they can be in bone also. So I showed you ones in soft tissue, but it can also be in bone. So you can have metastatic. Let's go look at bone ones. So let's see if we can find metastatic here. I don't see metastatic. I know I have them.
Right there. Metastatic.
Where?
You go up a little bit. Down. It's right there.
Oh, right there. And then there are moth-eaten ones too. Here's one of the breast.
It's so hard to tell.
Oh yeah, you can. All right.
Okay.
Bone is the worst one. Yeah?
Yeah.
Bones are hard. It is.
Yeah.
It's going to take a lot of study. I thought I had better pictures, but I don't forget. All right, you ready for the quiz? Let's
All
get-
right.
I know Dr. Rich's coming in. We've got to do the quiz before she comes in.
Yes.
Oh, to give us our quizzes,
Yeah.
our midterms.
Oh
No,
yeah,
part of
that's
the
what
quiz.
she's going to do.
What is she gonna do?
She's coming in to give us our
Midterms.
midterm
Oh.
to see what we missed.
What we missed.
Yeah.
All right, here we go. So study bone, good. So this is a pre-quiz. Bone, okay? All right, here we go. Oh, just fill in on it, isn't it? Huh?
Yeah.
Well, that's easy. Okay, you ready?
Yeah.
That was an easy one. One thing she could have said in here that she didn't, but what could she have put in the history? Yes. What they're looking at, I think, is this right here. But the history tells you without even looking at the X-ray.
How about the other side? We don't look at the other side?
You know, what she's looking at is this right here. Oops, I
But
need
we have it everywhere. We have it that side.
The 70
too.
year male prince with loose teeth. So these teeth were loose in this area.
Did this look like a sun first too?
Pardon?
No.
And it's numb. Lip is numb.
They all have a cavity. It's under the cavity. All of them has cavity.
Well, they had fillings. He's got fillings. Oh, all those teeth have cavities?
Yeah.
Yeah,
So we had something that was on a cavity tooth under.
could have been. May not have been a cavity either.
They're gonna go crazy.
Okay, number 3.
Oh, that one has a cavity. Yeah.
Don't need expansion associated with
No.
Oops. All right. 4. This one's tough, but read the history.
8:30.
It's graded at 270
Yes.
Okay.
Oh,
Yeah. Just that one.
Yeah.
The picture is nothing. Goodness.
And no pain is aspirin, relief for aspirin. You have to know your notes pretty well on this one.
that's what I'm gonna do for this. Like, I'm gonna
Yeah.
write even the health history.
Okay, here's 5. This one's easy. Look at the x-rays. Classic. Age classic.
The glass.
Okay, 6.
The tooth is okay. No cavity on it. Okay.
Well, there's a little filling, but not enough.
Not, yeah, not a big cavity. Okay.
We talked about this.
Yeah.
Okay, 7.
It's a sun one. Sunburst one.
Oh, yeah.
Eight.
Oh. What is you?
You don't need more time on that, right?
Mm-mm.
9.
He showed us this picture.
Yes.
Yeah, we did see it, didn't we?
Yeah, we did.
Metals. The worst one.
This This is a long quiz.
Yeah,
Because it's a bone.
I'm glad.
wait till you see the test next week.
Oh goodness, yeah, it's
I
gonna be
haven't seen
fun.
it yet, but,
Goodness.
all right, last one.
She gonna spread us. That corner, this corner, that corner.
I'm gonna go back and look at one here.
Can I look at number 2? Yeah.
You don't even have to look at the x-ray. We gotta read the history.
The 75-year-old man present with loose teeth.
Yeah, x-ray's telling you everything.
Okay.
What is expansion? Means big?
Expansion means big.
Numbness.
Okay.
All right, you ready to grade them?
Wait 1 sec. Could I see number
Yes,
one?
please.
One you're worried about?
Okay, just want to make sure.
Look, it's on the apical. And something with apical.
That's right.
I think so.
Wow, this is like the longest pre-quiz ever. Are you sure it wasn't a close quiz?
No. On the top is
Okay, you ready? We're gonna
Okay.
grade them.
Yeah.
Okay, what is one?
Periapical cement.
So it's this plastic,
Yeah.
right?
Oh.
Early
Okay.
stage.
He kind of
Yeah.
gave me that face like,
Yeah.
you got that wrong.
Periapical,
I-
yes?
Periapical.
Yeah.
Right?
Do you think if I write with this, she's gonna get mad?
If you write what?
But not pencil pen? Because
It's fine.
really?
Or red or whatever.
Okay, everybody got that?
Yes,
Mhm.
period.
2. You don't even have to look at the x-ray. What'd you
I was
guys put?
confused on this
I
one.
didn't put anything, I didn't know
I
that.
mean, I see it's on both sides.
I said osteosarcoma.
That's
Yes, why?
Because of the birch, that's what I saw.
Because of what?
When I saw the white.
But I
and
wouldn't
the
even go by
age,
that.
the
What's it say?
numbness,
70-year-old
expansion.
man, expansion,
Yeah.
numbness, he had loose teeth, all telling you it's osteosarcoma.
osteosarcoma.
But I did put osteosarcoma for another one.
This could be chondrosarcoma too.
That's what I was, yeah. But I put osteosarcoma.
So if you didn't get it, you marked that. You should have known that one.
Okay,
So mark it wrong.
sure. I didn't write anything, so.
Okay, so put a line,
Okay,
just a check mark.
got it.
Did you get that?
Yeah, I guess on that one.
Good job.
Yeah, but the history tells you. This one is hard.
This one is.
Where did you put?
Condensing.
Then osteoid.
Condensing
Ossifying?
ossified. Because it has a cavity and condensing?
Osteoid?
Yeah. Why? Because the tooth has a big cavity and that.
No, you're looking at the radiolucency
Occluded.
behind the tooth.
Ossifying
Oh.
fibroma?
That's why.
No, is it?
I put ossifying fibroma.
Okay.
Oh, that's radio PEC. Got it.
So it's ossifying fibroma?
I think so, but
Okay.
I think it is. I have a question on that, and we'll see why. Okay, so how many got it? You got it?
I
Fine.
get it.
Didn't get it.
Okay, 4. This was a hard one.
Blastoma.
Yeah, because of
Osteoblastoma.
Osteoblastoma.
Yeah.
The only reason I know, well-defined and greater than 2 centimeters, right?
Mm-hmm.
How'd you know that one?
Because
Greater
of the
than 2
greater-
centimeters.
Yeah.
Okay,
I know.
that's such a rare
And I
lesion.
asked you
That's
to-
such a rare lesion.
I told you like osteoblastoma. And then
Okay,
you
what's
let
this
me know.
one?
I said.
Classic.
5.
Is that 5?
5.
Okay.
That one is.
Ossifying fibroma. Because
Nope.
one side is bigger than the other side.
Right,
Fibrous dysplasia.
fibrous dysplasia. Classic.
Fibrous
I even showed you the picture here
Yeah.
10 minutes ago.
Mhm.
Got it.
Expansion of the jaw. So you got that right, sir? Yes, no? So you got to mark it wrong.
Nope.
But the X-ray here is right on. Glass, and this is the best diagnosis in a teenage female. Remember I said young?
Yeah.
All right. Okay, this one.
What is that? 6?
6 is idiopathic.
Osteosclerosis. Yep.
Wait, 6 is. Oh, okay.
Idiopathic osteosclerosis.
Okay.
7, classic
Oh yeah. I put what?
7 is osteosarcoma.
osteosarcoma
You see, I put okay.
or chondrosarcoma.
Okay.
Either one. But main classic osteosarcoma. Okay, this one.
It's easy one. The
Torus.
Torus palatinus.
Maxillary palatinus.
Wait, this one?
So 8 was Taurus palatinus.
8 was. Oh,
The
okay.
last one, yeah.
Okay.
It's on a palate.
9,
9 is
Metastatic.
metastatic carcinoma. No? Goodness.
I said
Why?
metastatic.
It's not another one.
you know, here's what I put, and I have to go back and look. I put ossifying fibroma, classic of ossifying fibroma. But why would she give 2 answers for osteo?
That's what I thought too.
Yeah. And I saw this picture somewhere else. Expansion of a young person on a young adult male. Okay, what'd you guys put?
I said metastatic.
Metastatic.
carcinoma.
No,
I discussed.
what'd you put?
I just put P. Paget's disease, but I don't know.
No.
Is it Paget? No, Paget is
No.
here.
So you guys
Oh,
all missed that one.
Yeah.
Yeah.
Yes.
So it's for sure ossifying fibroma.
I don't know. I'm gonna have to go look here. Now this one, what?
And that one is what is it? Osteomyelitis.
Osteomyelitis,
Myelitis.
plastic.
Mhm.
After a tooth extraction. It's got that moth-eaten.
Mhm.
It looks a little wrong. Awesome.
But somewhere, let's see if we can find that, somewhere that one picture. Let's see if we can find that. So I want to look at her stuff on. Somewhere on her lecture, on bony lecture, let's look at bone diseases. Oh, that's the, we don't want that, that's the, we want. I don't know,
What was number 2 again? That was the osteoblastoma, right?
Which
two,
one?
Osteosarcoma.
Sarcoma. Oh, okay.
Osteosarcoma. Oh.
I'm gonna go back and see if I can find.
I have to start to study this bone.
Me
Not
too.
regen.
We're gonna get 100 you guys next week.
Okay, let's see if we can find the answer to that one. Here's the thing, we wanna look at her bone lecture. Bone diseases, is this it? Yeah, okay. All right, here's her lecture. Okay, multilocular radiolucencies. Okay, this is a melablastoma,
Mm-hmm.
right? Typical. Expansion of the bone. Here's a thyroid, a hyperthyroid, brown tumor, hyperthyroid. Okay, we talked about how, here is central giant cell, a young person. Here's a odontogenic myxoma, we looked at that. Here's a chondrosarcoma,
Hi.
multilocular.
Hello.
So, hey, what is this? We got a question here.
Yeah. Why aren't you projecting it?
Why am I?
Yeah. Why aren't you using the projection thing? The power.
Oh, I use my PowerPoint.
Yeah, but why don't you project it? Why don't you
Oh,
use that?
sometimes I do.
Oh,
I just
was
forgot
gonna
to.
say. It's
Sometimes
bigger.
I
I
do.
think their things are easier to see. That's a nice screen.
I think they changed it.
When we took this quiz, what was the answer to?
Oh, pull up the quiz. Oh, don't show them the quiz for next.
We already
week,
did,
though.
no.
No, we didn't.
Oops. No, I'm just kidding.
Is it?
What,
We did this one.
okay, what is this?
Why it's not the condensing?
Click the one down the bottom. That
There we go.
projects it. Okay. So why is it not condensing osteitis?
Yeah, it's
Because
the
it's
cavity.
lucent.
Oh, that's radio.
So
Yes,
condensing
she
osteitis
totally was
is
looking
always
at the
okay.
wrong thing.
Yeah, okay.
Yeah.
You didn't, she didn't see the
lesion.
radiolucency.
Got it.
Yeah, the radiolucency is the lesion.
Right.
So what did you put?
Ossifying fibroma?
Ossifying fibroma is possible in the early stages.
Okay.
I would expect it to be a corticated edge, but I would take that.
Okay.
Yeah, I
So-
put ossifying fibroma
Okay.
in mine.
So ossifying fibroma usually has a nice corticated edge, and I think the biggest clue to the real identity of this one is the fact it has no bone reaction. This one happens to be a central giant cell granuloma, but you know, there's,
Yeah,
other than that, there's no way you would know. So anything that could be a pure root radiolucency
yeah,
would be a good answer.
Okay.
yeah.
So I'm happy with ossifying fibroma.
Okay.
What
Yeah.
else did you put?
They
Um,
totally missed it.
I missed. Yeah, I looked at the radiopaque part and put
I don't know why they were looking at radio, both of them looked
The
at radio, you didn't see
radiopaque part
the,
is the normal bone.
they didn't see the, they didn't see the radiolucency.
So you guys are gonna miss that.
Yeah.
But pretty much anything that could be a pure lucency that's a benign lesion would be an acceptable answer for that one.
Mhm.
But you know what, I never even thought of central giant cell, now I look at it, I would have thought it more to be multilocular for giant cell, but,
In the jaws, it's less often multilocular than it is in the skeleton. So sometimes it's multilocular and sometimes it's not,
right,
but it can be multilocular, sure.
but, and the age is just right for it, actually,
Yeah,
for central
the
giant
age is
cell.
pretty good, so.
And then the only other one we had, this was a hard one,
That one?
Just greater than two.
So the
and they all got it
fact-
right, I would have missed it.
So the fact that it is mixed to opaque and pretty uniform
And it's
is
very
that it's a
well
bone
defined.
and it's very well defined.
And
So-
larger than 2 centimeters.
So,
And it's
right,
greater
so
than
what
2
other
centimeters.
answers did you put?
They all put
They all-
Because it's
osteoblastoma.
greater
Okay.
than 2 centimeters.
They all did that.
Yeah.
I'm
But
probably the
it's
only one that,
nice and round and mixed and so it fits with the bone.
I'm the one that
form.
had the hard time with that one.
Yeah, yeah. That's
And
a
then,
beauty.
they missed this one a little bit, but a
This
couple of them did, yeah, I don't know why it's
That's a
plastic.
beautiful ground
Yeah,
glass
right.
bone.
They got this one all right,
Good.
they got that all right.
This
course
one
they
is
You
got
have
easy.
gotten that one.
This one, they
It's
had a
an
hard
easy
time
one.
with.
That one's.
Nine I got
That
wrong.
one I like it because it's so perfectly
So
round,
round.
which fits with a benign neoplasm.
Right,
Okay.
And
And
not an
nice expansion.
odontogenic something, so it's uniform buckling will to.
What is the
mesial
answer for that?
That's an
Osteo-
ossifying
ossifying
fibroma. If you put
Fibroma.
osteoblastoma, I would actually take it,
I don't think they put
but
that.
I don't think it fits as.
I
well
I
with
chose
this.
meta one.
Yeah,
Metastatic
I
carcinoma.
said-
Oh, now metastatic would be very irregular, it wouldn't be nice and uniform and round. Cancers are never nice and uniform and round, so that's a clue. Metastatic wouldn't have that mixed character too, because this looks like bits of opacity made by the lesion, it's not a normal residual bone kind of trabecular pattern. The other thing that's against it being metastatic is the age of the patient. We don't see cancers that metastasize to jaws in young adults.
Yeah.
That's middle-aged and older.
And what'd you
adults
put
get
on
the
that?
I put that one too. I
You
had
put
no
what?
idea metastatic.
Oh, you put
Yeah,
metastatic
I
also?
had no
And to
idea.
me, that was,
And then I was looking at, I thought it was like repeating itself. I put that one down.
So.
Well, they're seeing bone is not easy. I mean, what they're
But it's
understanding.
easier than they think. If you just look for some basic principles, so this shows principles that fit with benign, so you gotta at least go with something benign.
And you look at
That's
age.
kind of and age can be very helpful. It seems like trivia to have to learn the age too, but when it comes to bone lesions, including odontogenic, constructing a meaningful differential diagnosis, the age has huge influence, influence.
Okay.
So.
But you know, one thing on age that threw them, well, they got it right, and I had a hard time with it. And that is actually on the final quiz,
The post quiz?
their granular cell tumor.
Oh,
Because you said a young person, granular cell tumor is usually 30, 40.
they can be, yeah.
Yep.
I've seen them at lots of ages though.
So,
That one has
and
a wide
I
range
said,
to
you
it.
know what? And they didn't put it. I would have accepted schwannoma on that one
Oh,
also.
yeah, me too. I would have
And,
taken that.
and
I put that first.
she thought at
then-
first and erased it and did.
So
granular
with
cell
soft
tumor.
tissue lesions, was that the one on the tongue?
That was the one on the
Yeah.
top.
Yes,
Yeah.
yeah, good.
Soft tissue tumors, what fits within neoplasm on the tongue that's continued to grow, not a reactive lesion like an irritation fibroma, they're most likely neural origin. So I would take schwannoma, neurofibroma, or granular cell
Right,
tumor.
right.
Tumor,
Oh,
yes.
Those are all good answers.
And they got that one all right. I think
Yes,
everybody got
yes.
that one.
Yay.
All the correct granular cell tumor.
Yeah, yeah.
Granular cell tumor is the one that particularly likes the tongue, but the neural tumors in general are more common on the tongue. So I'd take all of those. Those are all good answers.
Yeah.
Okay.
No, that worked. That worked good. That was the only thing that threw me
I
at
don't,
first.
if you guys aren't done, I
No,
won't
we're-
bother you, but I brought their printouts
Okay,
from
go
the
ahead,
section
Listen.
exam.
Yeah.
So if you have a little bit more to cover, you could go over these with them and then just bring them up to me when
Okay.
you're done. Will
All
you
right.
do that? Or
All
do
right.
you think you have questions?
All right.
Oh, wait.
I'll just leave them with you and bring them up to me when you're done.
Awesome. Thank you.
You're welcome.
Bye. Oh, wait, are you coming back or?
Do you want me to? Do you have questions about it?
Just wanna look
Yeah.
at it.
Yeah, we just wanna look at it.
Text me
Yeah.
when it's
Well,
time to
text
come
me.
back.
So this is the test?
Yeah,
Oh, okay.
it's just their printout for the questions they missed, so they can look at the ones
Oh,
they missed.
only the missed.
Only the
Oh,
ones
okay.
that
Oh,
missed.
yeah.
Oh, okay, gotcha.
Yeah, that's one of the nice things that ExamSoft does. But I'll stay if you wanna go over it right now and ask
Yeah,
me
you
questions,
ought to
might as
stay.
well.
Stay.
I wanna know, is it just me knocking off that, oh no, there,
Here, honey.
the wheel is broken on this, you sit on it and it goes wonky.
Thank you.
Okay.
So I have a question. So this part, they don't have lots of mitosis, means lots of, no? Like hard to.
So the question is, what is most predictive? The fact that it's most predictive is important. So which of these helps you best know if it's gonna be more aggressive compared to less aggressive? So this one's the best answer. This is the one that's most predictive. But mitosis it's an important characteristic of a malignancy, but it's not as predictive of behavior as differentiation. So I wrote the questions on neoplasia, but Dr. Grandi did the lecture. So I had to look at her notes and try to figure out things that I thought you should have known from her handout. And I thought that was one that you would know, but
Okay.
who knows?
Heidi, is that a E?
Yeah, it's an E. Oh, like a
It's a
little,
little E,
little
okay.
E.
So is it true that infection would be a greater cause of delayed wound healing than like wound dehiscence?
It's a more common cause.
More common
It's
cause.
not a greater, it's a more common cause. By far
Okay.
and away, the most common cause of delayed wound healing is infection at the site.
Oh, okay.
Are those your granddaughters?
Yes, Heidi's. They're
Heidi's or
15
Heather's?
There's Heather. They're 15 and 6, or 14 and 16 now.
Oh, wow.
I missed a dumb question.
I'm so sorry.
I know.
Which one?
It's the which one is most likely diagnosis for a person found with cool, pale, clammy skin?
What'd you
Yeah.
put?
Cardiogenic shock.
So,
I did see
that is
actually.
how it would present, but most likely also involves what is most common. The more common disease, everything else being equal, is the more likely.
Mhm.
Hypovolemic shock is more common than cardiogenic shock.
But it can happen in both, correct?
Oh, that's the classic presentation for both of them. So the only reason that hypovolemic shock is a better answer than cardiogenic shock is because it's a more common
Okay.
event. So, malware bites.
Wait, what?
He's got malware bites. Good choice. I have malware bites. That is a good program.
Have what now?
Malware bites.
Oh.
I love my malware bites. It has protected my computer from things that
Really?
Norton couldn't find, and the in-house university system that they use is garbage. So I love my malware bites.
Still between malignancy and
Oh,
benign.
Which one?
This question.
28.
Yes, it's not the speed of growth. No.
Speed of growth is helpful, but it's never the best indicator of benign versus malignancy because there's such a tremendous range of growth rates. And there are some benign tumors that grow faster than some malignant tumors. So that one is never the best. So when you're talking about a benign tumor, rapid growth rate fits with malignancy better than benign, but it's still not the best predictor. So what fits best with a benign neoplasm is encapsulation. We virtually never see a capsule with cancers.
Yeah.
That fits very well with benign. There are some benign tumors that don't have a capsule, but virtually no malignant ones that do. All done?
Yeah.
Thank you.
I was very pleased with the performance
Ah.
on this exam.
Oh, thank
Thank
you.
you.
Nice job.
Have to study more of that bone.
Yeah.
Yes.
All the hard
You
work.
have to study
Now it's
this
gonna be
week.
hard.
Yeah. Just extra studying.
So we just meet one day, because I'm not available on Thursday mornings.
Okay.
So you get a break, you get Thursday morning open for a little bit.
Okay.
And then two weeks after that, or three, whatever, after Thanksgiving,
Uh-huh.
then Dr. Thompson meets with you for the last time on Thursday and Friday, and he said
Okay.
he's doing a general review for you as
Sunday.
well on
On
Sunday,
Yes.
That's
which
nice
is
of him.
nice.
Yeah.
Yes.
Yeah.
And I hope that doesn't interfere with your preparation for finals, but are you guys gonna be all right?
Yeah.
Okay.
Should be good.
I
Very
think
good.
for final we can't do anything to change the dates, nothing, because just one sec, I think on 12th we have another, no, we don't have anything, awesome, okay.
So when is our final scheduled?
Here,
I already forgot when it is.
Monday 9th, we have nutrition in the morning, and I don't know what is it.
Then clinic, and then you have a perio final on Tuesday.
Yes, Tuesday morning, and then at
And
1 I
hygiene,
think,
another one.
topic 1, that's education, it's not that bad, and then Wednesday we have, oh, that's education.
And so this is the only one you have on
Topic 1,
Thursday.
that's med,
Yeah.
can't come. Yes.
Alright, that's okay.
So-
It,
Yeah, we have, what time? 12. We have it, yeah.
I don't have the schedule with me and I haven't looked at it. It should be on your schedule right there, the time.
Yeah, it's
Or
1
does-
to,
what does it
1 to
say?
4.
It's 1 to 4 and it's in the Dean's Conference Room.
Okay.
If that is not enough prep time, it is not a problem for me to do it on Friday. But most students want to take off as soon as finals are over because it is Christmas break and most students are traveling.
Okay.
So,
Okay.
you know, it would have to be
And it's different.
100% agreement if you wanted to move it out.
Okay.
It would have to work for absolutely everybody's schedule, but I could move it to Friday morning.
Okay. Can we like talk amongst ourselves?
Yeah,
and
yeah,
then
and just let me know,
Okay.
Sure, thank
because
you.
I know you do have other classes that you must study for, and I don't want this to impede things too much, but it's not a problem for me to
Yeah.
move it.
Oh,
I
cool.
just have to find a different proctor, I'm supposed to be in a faculty meeting then, and,
Uh-huh.
but, otherwise I was planning to proctor it, so we'll see. But we could move it that far, okay?
Cool.
good.
All right?
Thank you.
Thank you so much.
Thank you.
I see you on Sunday, and bring your voices. Get on back now.
You don't have to come.
I need the unit so badly, you have no idea. I might not be able to renew my license if I don't. I've been thinking about taking an implant course or something, I'm desperate for units.
Alright. So, any questions on the phone? So you need to. So you saw some on this the last quiz we took was the pre-quiz, wasn't it?
That was hard.
That was hard.
Yeah, I thought it was hard.
But you did pretty well, Heidi.
Yeah. But I still like, 2 of those were like, guessed.
My grade is on the borderline. It depends all to the final. Yeah. It's sad. My feeling again, I'm gonna be out of the school.
Well, it's hard to understand some of this without, on bone, without knowing the histology, and yet you guys shouldn't get into the histology, because all this bone stuff looks alike. But what's interesting, both you guys missed that radiolucent lesion.
Yes, I just saw the cavity.
And now that I look at it, with the age, yeah, central giant cell, but you put osteofibroma sodality.
Yeah.
I mean, to
I
me, it
put
was
that,
classic.
yeah.
And actually, it was well-defined, which is of osteofibroma fibroma is well-defined. I never did think of giant cell, but now that she says it, yeah, it could be. But, and the age was that. So, you know, you can see that there's a broad range of things you could put on some of this stuff. That's why when she says, well, what is your top diagnosis? Well, we are giving you credit for other answers, and she is too, even though she says for the top one. Yeah. Yeah. All right, so then I'll see you in a couple, it'll be 3 weeks, right?
2 weeks,
No,
1 week.
3 weeks.
3 weeks, because it's next week.
So we're
is
skipping
next-
one, I think.
Yeah.
Yeah, Dr. Richard's gonna see you.
Can we go over the slides for bone and then
Yeah.
leave? Thank you. If
Oh,
you-
yes,
Yeah, thank you.
okay, yes, her slides for both.
Yes.
Right, the ones we were starting on, yep. But it's not the quiz, it's
It's a lecture.
the lecture, let's go over it. Although she didn't name, yeah, let's go over it.
You had something
This one is always.
Only this.
It's fine.
Okay, let's look at,
Thank you. Thank you so much, Eddie.
okay, here we go. All right, good. I'm glad you said it before I go through this.
That was something else, or that was this?
She didn't give a lot of information, but, you know, what you see on this kid, fibrous dysplasia, you can't tell it's fibrous dysplasia, but his is asymmetrical. I mean, there could be other things that could do this. This could be, fibrous dysplasia is good. Here, cherubism, I don't know. If I would look at him, I'm not sure I would say cherubism. It's
a
not,
little chubby kid.
yeah, it looked like a little chubby kid, right?
I've seen a lot of kids that look like that.
Yeah.
They do have cherubism.
Now, these people, polyostotic fibrous dysplasia, how do you know that? And yet, hers is Paget disease. They both got expansion of the maxilla. So she's older, he's younger. Age is difference, all right? But they both have expansion of the maxilla, all right? Now his is polyostotic, so he could have it both sides. Monostotic is usually one side, all right? So, I'm not sure. This is no problem. And bony sequestrium, yeah. You see this? Often little pieces of bone come through, like here. Florid osseous dysplasia, you see the same thing. It never heals. Remember, florid osseous dysplasia, you never want to extract the teeth, because remember, florid osseous dysplasia is in black people. Okay, black women, and they have all this radiopacity, okay? And the bone never heals right, so you try not to extract the tooth, otherwise you have the sequestrium that comes through. So here's a sequestrium. And a lot of times people get just sequestrium. For example, a lot of times, let's say somebody ate something sharp and they actually ruptured the mucosa, okay? And what happens then, the bone's exposed. So a lot of times if that epithelium won't heal over that bone, it will never heal because the bone underneath it was dead, and you have to get rid of that dead bone for the epithelium to go over it. Right? This is easy. Buccal exostosis. This is one you can put a cup of coffee on. Parulus. Oh, okay. A parulus is a gum boil.
Do we have it?
A parulus? Yes, I'll tell you where.
Yeah, here, let me show you.
You know where it is? It's not in.
It's in the.
It's in pulp and periapical.
Let's see this one.
Which one? That's a bone one.
Is this the one where?
Should be pulp and periapical.
Yeah.
Should be. Parulus is a gum boil. So under dental abscess, there we find it. I'm on page 3 of dental abscess. A parulus is a gum boil.
It's not bone.
No, this is pulp and periapical. You looking for parulus?
Yeah.
Okay, look at pulp and periapical,
Got it. It's on the top.
and it's on page 3.
Yeah.
I don't know why this is in there now. This is not bone. Osteosarcoma, expansion, loose teeth. All right, irregular bone. Here's well, this is parulus, but it's osteomyelitis too. I remember seeing this guy. We actually thought when he came in that he had osteosarcoma, this guy, because the bone was very, very moth-eaten. Fibrous dysplasia again. Here's one you had on the quiz that some of you missed.
Yeah,
Sarah,
me.
you missed it.
I missed that.
Brian, you missed it.
I didn't know.
Here's Paget disease. This is the maxilla is expanded, but fibrous dysplasia is one side. Paget disease is both sides. Here again is Paget disease. Metastatic. I mean, from the picture, I'm telling you, from the picture without a history, you can't tell what these are. you may have an idea. So this is radiopaque interpretation, lucent, opaque, or mixed. Okay, and these are well defined. Okay. So this is diffuse. This would be a what?
Radio pig.
It would be a bone scar, but if
Yeah.
but it could have been if a tooth was there before, it could be idiopathic osteosclerosis. This one here, multilocular, what could this be?
Oh, we talked about.
We talked about that.
Yeah.
Could be an ameloblastoma,
Ameloblastoma.
or this is actually, I know what it is, it's a central giant cell. You'd have to go by the age somewhat,
Yeah.
but they're gonna look the same. They're both multilocular.
Okay.
Lucent, ill-defined. Oh yeah, look, you know what, okay. You can make the, look at this one. Widening of the ramus of the mandible on both sides. A young person, because look, these teeth are
What is that
impacted.
one?
Huh?
What is that one?
That's what I'm asking you.
It's that one that has on 4 parts?
Yes.
It's Pharaoh something. Pharaoh something?
Young person.
Like Cemento, no?
No.
Dysphagia? Oh, that's on a 4 part.
Young person, it's got soap bubble lesions in 2 or 4 quadrants. Come on.
Oh.
Oh, yes, what?
So cool.
Have you said your prayers today?
But
Is that a
I-
hint?
Yeah, prayer. Soap bubble.
Yeah.
One of the first ones he said.
Prayers you
General
look where?
giant cell?
Oh, cherubism.
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 Because of the
Oh.
prayer.
You didn't
Okay,
get that
yeah.
hint, did you?
No.
Oh,
Cherubism.
So that's cherubism. Okay, here's a good one. On the
Extensive.
apex, well defined,
Idiopathic?
doesn't have a radiolucent rim around it.
Idiopathic
So
or
it's-
still...
Idiopathic,
Still...
this would be condensing osteitis.
Oh.
Oh, but
But it's a
there's no
healthy
deep
one.
filling.
Yes,
So
it's
it'd be idiopathic
idiopathic.
osteosclerosis.
okay.
Yeah, idiopathic, because there's no deep filling.
Yeah.
Okay, you agree?
Yes.
Here is the one that,
Oh,
She
I know,
had?
yes.
I don't know how you guys ever got that.
Greater than 2 centimeters.
So it's greater than 2 centimeters.
Here is a good one. And it's a later
Less
stage.
than 2 centimeters.
It's audio, it's radio opaque with a radiolucent line around it. What do you think on that one?
Oh.
Apex of the tooth. It's in a later stage. It's in the middle stage.
Okay.
The second one?
Yeah, the second
Why
second
it's
stage.
not osteoid... Ostema? Stoma? No?
You would get it if there was more than one tooth, but here she's only showing one tooth. What if it was several teeth like this?
I remember writing.
Perioapical one?
Yes.
Yeah.
Periapical what?
Oops.
Periapical
Cemento.
cemental dysplasia.
Cement, yeah.
Okay.
What would be a hint? This would be a black female.
Oh, black female.
Yeah. So somebody went in and started a root canal on that tooth, which you probably don't need a root canal. Okay? Widened periodontal membrane. What did we say if you have a widened periodontal membrane without a reason?
Hyper something. Hyper...
No.
No?
Hyperparathyroid
Yeah.
is a loss of the lamina dura. This is a widening of the lamina dura.
Awesome.
Hypo? No.
And here's a widening of the periodontal space with pain. What if there's a lot of pain and it's got widening of the periodontal membrane? And it's a tooth syndrome,
Osteosarcoma.
osteosarcoma. Right.
Is that the one with the sunburst? Or
Yes,
that's the one?
osteosarcoma can be sunburst also. Yep. Widening of the periodontal space. Okay, unilocular radiolucencies. This would be probably a non-vital tooth, so this would be an apical cyst versus a chronic apical periodontitis. This is classic here. You got a radiolucency, black female, early stage, would be, well, you guys didn't have focal segmental osseous dysplasia. She didn't give it to you. Well, let's say periapical segmental dysplasia,
Yeah.
if it was more than one tooth. All right.
So if it's only one tooth,
If it's only one tooth and it's focal,
Okay.
and it's in white females,
Okay.
not,
Oh,
it's not in black females.
so focal is okay.
Here's a nice one. I mean, this could be several things. But she said it's not ossifying fibroma, which I agree. A central giant cell, look, they look the same, right?
Why it's not bilateral tumor?
Bilateral what?
Tumor? We had a bilateral something. Cyst? Bilateral cyst.
Oh, by for
It's between two teeth. It's
Central-
radiolucent.
Okay, that was a
Radius.
lateral periodontal cyst.
Yes, yeah.
But
well,
they're not bilateral usually. They're between teeth. But this is too big for that.
Okay.
But see, these look the same, so it could be either one. That's why she said that one we talked about could be a central ossifying fibroma or central giant cell. So, yeah, this would be the possibility. This would be a younger person. And this also could be unlikely. What's another possibility besides these two? One of the odontogenic tumors.
Lateral.
lateral
Too big for a lateral periodontal cyst.
It cannot
bifurcation.
No, no.
Okay.
One of the most common odontogenic cysts,
The generous? No. The generous?
unilocular
No.
I mean, little.
ameloblastoma.
Really okay.
Could have been that also.
Oh,
Here's
no,
a simple bone cyst, and
That one wasn't it, please.
see how you goes up between the teeth?
Yeah.
Here's the one we had today,
Yeah.
Oh.
Yeah, this
central giant cell. But I agree, but sometimes they're a little more soap bubble. Here's well, this is the same one. Here, now look at this. What's the possibility on this one? Besides unicystic ameloblastoma, what's other possibilities?
Dentigerous.
Yeah, dentigerous. Yeah, it's a large for dentigerous, but yeah. But those would be the two. How about a ameloblastic fibroma? Kind of large for that, but those are in young people and often on impacted third molar. Multilocular, okay. Ameloblastoma, okay. How about a central giant cell? Yes,
Could be.
Yeah.
could be.
Yeah.
Here's here's hyperthyroidism. It's a brown tumor. We really didn't get into that one. Central giant cell tumor. This would be a young person, but this looks like a ameloblastoma also. But often young person because look, here's a second molar that hasn't erupted yet. See? Odontogenic myxoma. This is what you guys referred to as what?
Sunburn?
No.
Soap bubble.
Spiderweb.
Spider
Oh,
web.
spiderweb. Oh, yes,
Yes,
my son.
yes.
Chondrosarcoma. This could be osteosarcoma. Other things it could be too. So here's another central giant cell. Osteogenic myxoma. There's so many things these could be. You just can't show the picture. Here's cherubism again, see? Bilateral soap bubble lesions. Young kid. Ill-defined radiolucencies. Osteosarcoma. You have to have a history here. You know? Here's widening of the periodontal membrane again. This is a very poor x-ray here. But it's ill-defined. Oh, but acute osteomyelitis. This was that guy that had the party. Metastatic carcinoma. Is this one you had? This is the one you had on the quiz. And she gave you history.
Yeah.
No,
You
you didn't have this. A similar one, but it was osteosarcoma. What is ground glass? Hyperthyroidism and fibrous dysplasia. Here's loss of the lamina dura, right? On this
Yes.
one. Yep, but they're both ground glass. Fibrous dysplasia, expansion,
Ground glass.
ground glass, usually in the maxilla. Here's central ossifying fibroma that you got, Heidi, and I put that too. Here's hyperthyroidism again. You get ground glass. Fibrous dysplasia, not a good shot for fibrous. Not a very good X-ray. That's the trouble. A lot of this. This one is classic of fibrous dysplasia. This one, I know you don't see hardly anything here. That's the point. But the history she would give you. Here's a patient. Here's a case where a patient has a lot of pain, excruciating pain, and maybe widening of the pleural membrane. Opaque lesions. What is this?
It's radiopacity. There's no cavity or.
No cavity. So idiopathic osteosclerosis.
yeah.
Very common. This one's a tori. Osteosarcoma, again, widening of the periodontal membrane right here. But you would have not noticed that without the history. Here's another metastatic carcinoma. Sometimes metastatic carcinomas can even form some bone also. Here's a good one. Condensing osteitis. You got a large filling, right? Or you got a crown on the tooth. Mm-hmm. You still can see the apex. So this is not cementoblastoma. Remember what cementoblastoma was?
Yes.
Here's idiopathic osteosclerosis. Tooth has no filling, but it's a bony thing. Compound odontoma.
Compound.
Here's periapical cemental dysplasia, a bunch of teeth. They're at the apex, lower anterior usually, black female.
Hard.
Huh?
That one's hard to see.
That's hard to see, yeah. Not a good x-ray.
Yeah.
Yeah,
That
I
one is
agree.
kind of hard.
This is classic. If you showed me this, I'm going to tell you periapical cemental dysplasia.
Mm-hmm.
This is cementoblastoma.
Okay.
Here's florid cementoosseous dysplasia. You may have one of those on the test next week. But female, black female, and you get some osteitis. Paget's disease in the maxilla, dense bone, you get in cotton wool. Here's that central ossifying fibroma we had. Here's calcifying epitheliodontogenic tumor. They're both mixed lesions. You don't know one from the other. This is well defined. See, what's hard on these things is, they're very similar, but sometimes there's minute things. One may just have a better outline. You guys don't know all the characteristics.
Yeah.
So it's hard for you guys. Yeah,
That's it.
yes. So what do you have the test on next week?
We're gonna have
Oh,
odontogenic
tumors?
tumor and bone diseases
Oh,
of the jaw.
post quiz on and bone. So you got odontogenic tumors and bone.
Bone, yeah. And then we have a pre-quiz of salivary gland.
Pre-quiz on salivary.
Yeah. And then the
That's
week
pretty
after
good.
that.
Is Thanksgiving?
Yeah. And then we meet up with Dr. Thompson.
And then final. That's it. 2 more.
Cool.
Thank you, Ivy. We're done?
What are your plans for today?
Go home and study some more for Sunday.